This month we're talking about diabetes and what happens with diabetes and what it takes to have good all-around diabetes care. You might have heard your doctor at some point ask you when was the last time you had an eye exam, and there is a reason for that, and that's kind of one of the things I'm going to go over with you today. This is one that is kind of near and dear to my heart. Both myself and the other doctor here, we're both diabetic. I found out about 6 or 7 years ago, and I kind of know what it's like to go through that, and so I have also learned a thing or two about what it takes to care for diabetes correctly. Diabetes is largely a vascular disease. It damages blood vessels, particularly small and medium-sized blood vessels. A couple of the organs that it affects, as you may know, is the kidneys, the brain. We all know about the numbness in the feet and the toes, and also the eyes are highly affected. But because it is a vascular disease, we as doctors want to observe these blood vessels to see what's going on with them, but the eyes are the only place in the body where those blood vessels can actually be seen without cutting you open, per se. And so when your doctor who's caring for your diabetes is asking you when the last time you had an eye exam was, that's largely what he wants to know about. How are the blood vessels in your eyes doing? And there's nobody better at observing that than somebody who's trained to observe the eyes, like an eye doctor, like myself. We will dilate you so we can get a nice clear view of the retina, where I'm looking for any bleeding or any abnormal blood vessels. We can also take photos, and I often do take photos, so we can look a little closer and make sure everything is all right. If it's not, we make referrals. And then lastly, one of the most important things with good diabetes care that I find is very important to me is I will always write a letter to your primary care doctor or whoever's caring for your diabetes so that they know what's happening. It's the more information they have on how the eyes are doing, the better decisions they can make and I can make in your overall care. So if you have diabetes and you have not had an eye exam in over a year, please give us a call. We'd love to make sure that you're doing all right. Thank you.